Hi, my name is Mark. I'm a respiratory therapy student. I would like to discuss with you the application of both raw and compliance on mechanical ventilation. First, I would like to talk about the application of raw. Raw can actually be found on the ventilator after executing a inspiratory pause. After executing an inspiratory pause, this will actually allow you on the pressure wave to actually identify the peak inspiratory pressure or the PEEP and the plateau pressure. And to actually get the pressure of raw of the patient, you would actually have to subtract the peak inspiratory pressure minus the plateau pressure, and that would result in the pressure of raw of the patient. And if the pressure of raw of the patient is greater than 15, this usually means that the patient has a lot of raw. In other words, there could be an obstruction, either as a result of the patient withholding a large amount of secretions, or through bronchospasming, or simply that the patient might be actually biting on the ET tube. Or if they're a trach patient, usually could be a little bit of a kink in the tracheostomy tube. And the next thing I'd like to talk about is compliance. Compliance, just like raw, can be also found after executing inspiratory pause. However, you wouldn't use the PIP, you would just use the plateau pressure and the PEEP pressure given to the patient. So you would take the plateau and you would minus it by the total amount of PEEP given to the patient, which is usually 5, and then you would actually divide that into the patient's tidal volume. After doing that, you would result in the total compliance of the patient's lungs. If the normal ranges for compliance would be between 40 to 60. If the patient doesn't reach the benchmark of 40, that usually could be an indication of a restrictive disease. And usually what happens if a patient has less than a 40 of compliance, usually that means that the patient might have a restrictive disease, and the only way to actually treat that would be actually giving the patient more PEEP. Another direction would be if it goes over 60, and if the patient's compliance does go over 60, that might be you would have to be concerned with barrel trauma, and not only barrel trauma, but also a potential chance of air trapping. Well, this kind of wraps up the video. I hope it was helpful. Thank you for watching.